Hey, good afternoon. I'm Amanda Johnson with the Department of Early Childhood Education, and we'll get started with our slides. Ooh, oh, I went too far. No, that's right. Okay, the Department of Early Childhood Education serves as a liaison between the governor, legislators, state agencies, and other stakeholders to maximize services provided to young children. So that's our mission. We currently serve birth to age 8 children through different programs within our department. Our first class pre-K is our most well-known program within our department, and it's housed in the Office of School Readiness under the Department of Early Childhood Education. So just a little background about first class pre-K. We have been, we're state funded, and we have met all 10 out of 10 quality benchmarks by the National Institute for Early Education Research, or NEER, since 2006. We just received word last week that we met those benchmarks again for the 18th consecutive year. So we're pretty proud of that. That's kind of one of those things we get excited about. All of our first class pre-K classroom learning is based on the Alabama Standards for Early Learning and Development, or the ALSDE. We serve Alabama's 4-year-old children. They must be 4 years old by September 1st of the year that they are attending preschool or pre-K. It's typically the year before kindergarten. If a child is eligible for kindergarten, they are not eligible for pre-K. We have a diverse delivery system that includes classrooms in private child cares, public schools, private schools, university-based programs, community partnerships, military bases, faith-based programs, and Head Starts. So we are all over the place. We started out with 8 classrooms, 8 pilot classrooms, and now we have over 1,500 across the state in all 67 counties. And we have the capacity to serve over 27,000 children. According to our registration system, which is ALSDE, we currently serve 181 children whose parents have self-identified as homeless. So it's a question on the application in our database, and that's how we get our information about our homeless children. Here's a breakdown of our 23-24 homeless children by region. The first class pre-K system is broken down into 8 regions, and they're color-coded here. It looks like of the 181, they are fairly evenly distributed across the state, even though some look fairly small and the region looks small. For instance, Region 4 is Jefferson, St. Clair, and Shelby County, so it looks like it's a small region, but it has the most classrooms, and we have 41 homeless children identified in that region. And then Region 5, which is the region I serve, has only 13, and it looks like we have a much larger region, but those are very rural counties, and we have smaller numbers there. We do see a bit of an uptick in our urban areas. Here's a breakdown of the demographics of the homeless children we serve. Of the 181 that are identified, 97 are female and 84 are male, and we have it broken down by race. Also, here's where it's broken down by delivery type. As you can see, most of our identified children are in public schools. Gidget Haslam is going to speak to you more about the services that we provide for our homeless children.
Good afternoon. First class pre-K guidelines addresses homelessness in our guidelines, where we say that children who are identified as homeless, they have priority. And as many of you know, first class pre-K has a random selection drawing process. But if a child is identified through their LEA or one of our other providers as being homeless, they do have priority. And they're immediately given an enrollment waiver. And with that enrollment waiver, that child automatically has a seat, even if that classroom has a capacity level of 18. They automatically are given a seat. So if you have a student that identifies as homeless, please work with your RD, which is your regional director, in order to get an enrollment waiver. Home visiting is one of the divisions in our department, and home visiting can serve children that are in shelters. They are an agency, really the lead agency in the state, serving home students through a home visiting program. And we have 3 different types of home visiting programs. We have the nurse partnership, we have parents as teachers, and HIPPY program. And many of you probably are already familiar with that, but they can help you provide some of the services that you need if you have children who need someone to come into the home, because they do start with some of the programs at birth or prenatal. With our department, we have a partnership with many agencies, and one of our biggest partnerships is with Alabama Partnership for Children. And we partner with them with Help Me Grow, Alabama Family Central, and Strengthening Families. Help Me Grow, we have all of our children receive the ASQ screening, and we partner with Help Me Grow in order to provide that screening free of charge to all our families. And our Help Me Grow is a free, confidential, centralized telephone access service to a care provider. And there are care providers throughout the state that can help with resources. They develop relationships with the community and maintain an accurate list of resources. We heard from 211, that is a part, they have a lot of agencies that they can connect families with when they go to this central location of Help Me Grow. Also, Alabama Family Central is a database where families can go in, they can search through zip code, they can put in a keyword. If they're homeless, they can look there, and it will connect them to resources in their direct area and statewide resources. So if you have families that need clothing or need some other resources, you can direct them to Alabama Family Central, which is an online database. They can click it in either with their zip code, keywords, any type service. They can put in 211, and it will give them that contact information. So it's a great service for families to use when they need resources as well. Strengthening Families is our professional development piece that we partner with partner with Alabama Partnership for Children in order to provide this professional development to our teachers. And also, it is a service that we provide to our families that each month we give them a different topic to help them with some of the things that they may be facing, some of those protective factors, resilience, social emotional development, some of those things of that nature. So we also work with our teachers in order to help them understand some of the things or issues that our families may be facing. Now, at this time, I want to thank you all for listening to how we partner with each of these different agencies, and also open it up for questions. If you have questions about anything that we covered today or how we're helping the children that we're faced with serving. No? All right, thank you so much.